How many people do you think die in one day of an opioid overdose? 10, 50, 100? Every day, over 115 people in the United States die of an opioid overdose. In 2016 alone, there were 2,012 opioid-related deaths in California. So, the opioid crisis began in the late 1990s as a result of pharmaceutical companies prescribing opioid pain relievers that patients would not get addicted to. So, in response to the crisis, the government should be taking specific actions. The prescription opioid crisis began in part because of Purdue Pharma, which is a company that makes OxyContin, a type of prescription opioid. They marketed their products quite aggressively to both doctors and patients. For doctors, they hosted symposia, which are all-expensive paid conferences in which they invite physicians to participate in lectures and learn more about opioids. Studies done by Orlowski and Wateska have found that these symposia oftentimes influence doctors' prescribing habits. They also targeted physicians that have already prescribed high amounts of opioids across the country. These doctors are oftentimes the least discriminant in their prescribing habits as well. For patients, they started a patient starter coupon program in which they would provide 7 to 30-day prescriptions for free. The company also claimed that the risk of addiction was small, using faulty studies that did not measure risk with long-time use, aka chronic pain, which is what opioids are usually prescribed for. Studies done after the fact found that opioid addiction rates were very high with long-time use. So the easy-to-acquire and highly addictive prescription was easy to abuse as well, and opioid abuse and overdoses skyrocketed. So, why hasn't the crisis been solved yet? There's been a general lack of effective treatment in our country. It's far easier to get high than it is to get access to treatment, and according to the Surgeon General, only about 28.6% of people who abuse opioids have received treatment for drug use in the past year. Treatment centers are underprepared and underfinanced. The primary care system has been slow to implement medication-assisted treatment, as well as prevention, early identification, and other evidence-based recommendations. In response to this crisis, the government should be targeting corruption in opioid prescription. Data from studies shows that doctors who receive payments from opioid manufacturers are more likely to prescribe opioids. Physicians who prescribe particularly large amounts of the drug were the most likely to get paid. According to data obtained by the Center for Medicare and Medicaid, doctors whose opioid prescription volume ranked among the top 5% nationally received twice as much money from opioid manufacturers, compared to doctors whose prescription volume was in the median. Doctors in the top 1% of opioid prescribers received on average 4 times as much money as the typical doctor. This correlation seems to suggest that companies are paying doctors to prescribe or possibly overprescribe opioids. We should be setting more guidelines for how pharmaceutical companies can give money to physicians in order to prevent this practice from becoming more corrupt. Some may say that doctors that are paid are the most likely to be the most educated about opioids, and therefore know the pros and cons to prescribing them. Though they might be educated, studies have shown that money does influence doctors' choices. Opioid manufacturers would not be giving money to doctors if it had no effect on the rate at which opioids are prescribed, and therefore the rate at which these companies are making money. Secondly, our government should be putting more funding towards treatment, specifically medication-assisted treatment and better systems. For example, Vermont utilizes a system called the hub and spoke system, which is highly effective. In this system, once a person is taken into treatment, they are placed into the hub part of the model. There they receive daily treatment, such as consultations and medicine. As they improve, they move into the spokes of the model, which include residential and mental health services, medical homes, and other periodical treatments. Under this model, Vermont averages below the national and regional averages of drug overdose deaths for 100,000 people, according to the CDC. And the number of people on their waiting list is far lower than the number of people currently in treatment. Adopting a system nationwide similar to the one found in Vermont would hopefully provide similar results. The system allows for fast, effective, and inexpensive treatment, as patients' fees are waived by Medicare. However, making these changes is a costly endeavor, and some believe that we should be using the money for other ways of dealing with the crisis, like cracking down on illegal sellers. Though these are important issues, it doesn't fix the current problem. There are still going to be people who are addicted to drugs. Instead, they'll turn to harder drugs that will be easier to acquire. So we should be focusing on treating people and preventing them from relapsing. Pursuing these courses of actions would mean a safer, more friendly world for both our generation and our children's generations. In order to make a change, call and write letters to your representatives in Congress and other government bodies in order to show them that the public is educated and cares about this crisis. Thank you.